At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Low Back Pain on Wednesday, August 14th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com. That's rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM WMAL.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey, everybody. Welcome to Dr. Tom Roselle Live, and I got another great program for you, one that's actually going to lead into our class this coming Wednesday night at the Roselle Center for Healing. Just, make sure that you understand the date. It's coming up the 14th of this month. Gosh, I can't believe that we're flying through the summer so quickly. At 6 p.m. at the Roselle Center for Healing. What we're going to be talking about is low back pain and all the things from a structural, chemical, emotional platform that can cause that to come up. If you've been listening to the program, we've been talking about the emotional triggers that can cause it, emotional low back. We've been talking about the psychological triggers. We're talking about a lot of different pieces that you wouldn't have thought about if you hadn't been listening to me. Now, we're going to deep dive into this diagnostically today and leading into our live stream program, Ageless Health, with yours truly. And I have a special guest on Ageless Health, and Dareth Painter, who's our thermographer, and she will be talking about how thermographic imaging can be very specific in helping diagnose low back problems. And we're going to touch on that today and kind of lead into the live stream. But I want you to understand that, and you've heard me talk about thermographic imaging before, thermographic imaging is something that records heat sensations, if you will, or heat programming within the body. Heat comes about as a result of injury and inflammation and those levels where the body can't control it. So a thermographic camera, if you will diagnose that. So what we're going to do today as well is we're going to give you some scientific data that you may not have thought about that the medical community and published in PubMed and Frontier and a couple of the other well-known journals are saying this imaging will correlate hand in glove with CAT scans and MRIs and things of that nature. It's really, we've known it for years because we've used it for a long time. But here's something that really finger points it. So let's start from the beginning. The basic premises of thermographic imaging, and as it relates to low back pain or low back problems, degenerative disease, stenosis, and so forth, is a variation in temperature reflected to the surface, meaning your skin. And you either have high temperatures or we have low temperatures. Both of them, if they're not normal, are finger pointing to something that may not be the way it's supposed to be. Okay? So specific underlying disease processes, things that affect what we call the musculoskeletal system, that means the bones and the muscles and the ligaments and the fascia and so forth, they vary relative to their presentation of heat caused by an underlying inflammatory response. Now remember, you've heard me say 1,000 times, when you hear the word inflammation, I want you to think about what? I want you to think about acid and heat. If there's an inflammatory reaction someplace in the body, it has to have a signal, either pain distribution, heat presentation, stiffness, impairment, and so forth. But now we can get real specific. We can find out where it may be coming from. But the question becomes, can a thermogram detect chronic low back syndrome? And any type of chronic low back pain that also can affect your legs, it can affect your butt, and so forth. the area will present with either cooler, cold, or warmer, hot skin distribution that is hand in glove, if you will, using the term I like to use, but it correlates to very specific segments, meaning the vertebrae, the bones of your spine, and their finger points and say, there's where it's coming from. So when we do an examination, an orthopedic, neurological, musculoskeletal examination in the practice, and we suspect that it's coming from this area, but we're not quite sure, before we even set out an X-ray, we do a thermogram, which has no radiation, and there's no side effects whatsoever, none, to give us a little better understanding of where it may be coming from. So thermography does not localize the pathology, but it can get much more specific relative to where it may be coming from instead of a general test. So here's the deal. When you come in, if you've been a patient of mine, we're going to test all kinds of muscles, and we're going to test nerves, and we're going to test balance, and we're going to push and pull on different things to try to figure out where this thing comes from. But there are, even with that, and even as specifically as we can get, because we know where the nerve distributions come from that go to the legs, we know where the nerve distributions come from that go to your toes and your calves and your feet, that triggers something called what? Neuropathy. It can come from the low back. It can cause the muscles to be tightened. But remember that it's a multidimensional situation. Sometimes, as we said in the past, you have this paid-for, rotund thing that's around your waistline, and you're putting a tremendous amount of weight that is not compensated for otherwise on the low back and your knees and your hips and so forth. So that's one piece, and you can tighten it up with core. You can drop a few lbs, and you can make life a whole lot easier. But sometimes we have organ-muscle relationship, particularly when it comes to the low back. We're talking about the intestinal tract because there's what we call lymphatic channels that come from the intestinal system that goes directly to the disc spaces of the low back. Now, if that's the case, and we're getting an aberrant, an abnormal, a toxic low back through the lymphatic channel to the back, that inflammatory reaction that's coming from that is going to show up in two places. It's going to show up in the back, particularly segmentally, meaning where the bones are, the disc spaces are, the ligaments are in the low back. But also, if it's from the intestinal system, the gut also is going to show evidence of an abnormal heat signal. That's not, if you just step back and you think about what I just said. I said the intestinal tract, your gut, your colon, large intestine, your small intestine, have these drainage channels. They're called lymphatic channels that will go to the low back. They're called Bates channels, and they go to the disc spaces. So if you're chronically eating things that you shouldn't be eating, they cause an inflammatory reaction, it will take a lot of this toxic material straight back to the disc spaces. The disc spaces get swollen, and now all you have to do is good old sneeze, a good hard sneeze, and so many of you don't sneeze outward. You hold that breath in, and you cause an increased pressure around that disc space, and now guess what you get? You get a slip disc. You get a bulge. You get compression that shouldn't be there, but that inflammatory response is still hanging out. So let's break it down a little bit more. These tissue triggers, if you will, this referral of this inflammation back to the spine will be not necessarily picked up under traditional testing, because unless you're in my world and you know what you're looking for, because every muscle has an organ system, but if you just do a traditional tap the reflexes and do this and do that, you go out and take an MRI or a CAT scan, and it says, yeah, you got a swollen disc, you got this, you got that, take the steroid. But unless they understand that there's a relationship there and pick up the warmer regions surrounding that feedback channel, they're not going to find it. So specific pathologies like a disc, a slip disc, specific pathologies like what they call a facet syndrome, facets are the gliding points in the bones, the vertebrae of your spine, often show excessive thermal patterns over the low back. and also in the muscles. We call them paravertebral muscles. Those are the ones that support the spine when you take a thermographic image. And it's straight there, it's straight up. So it gives you a better understanding. So if I do send you out for an X-ray, if I do send you out for an MRI, I can be much more specific relative to what I'm looking for. So while thermography provides very valuable information, it works in parallel with other forms of diagnostics, enhancing the understanding of where the problem is coming from. Subsequently, you can treat it much more effectively and much more specifically and get rid of things on a permanent basis, and always giving the patient the opportunity, always giving the patient the choice. Do you want a fix or a Band-Aid and so it doesn't bother you at that moment in time? Or do you want to resolve this thing and get it done once and for all? Remember, as I go through this, there's only three things that cause anything. It can either be an injury, and the injury can be subtle or significant. It can be biochemical, bioelectrical, all the crap that's outside of our body, all the exogenous stuff. Or the third is the what? It's the decision processing in the mind. How you think affects everything that takes place, and you have to make sure that you take control of that old mind of yours and make sure that, you're not contributing, if you will, to the problem. So there was an interesting article, and this goes back actually 2 years ago. You know me and my articles. I like to, dig in and make sure that everything that I'm telling you has merit and substantiation and so forth. But this thing was, it was printed in February 7th of 2022, and a guy by the name Alejandro del Estal. And it was actually a really good article, and I read through, and it was typical back injury and pathologies as it relates to scientific evidence on how thermography can help understand the clinical, but also, as we talked about a minute ago, the subclinical pathology, the other things that may be contributing to that low back pain. By the way, including things like hernias, when the intestinal tract of a guy kind of bulges out through the lower abdominal wall, or sometimes it goes right down in your testicles. But we need to understand, is it neurological? Is it organic? Is it, the intestinal tract, or is it something else that may be contributing across the board? But a thermogram will help us understand that. And this Wednesday evening, the 14th, by the way, I'm going to be doing this with you. I'm going to be showing you what thermography actually looks like with the low back problem. I'm going to be showing you how to specifically diagnose pathology opposed to something that happens directly in there. Dr. Harlan Browning, who we call the professor, many of you know and love Harlan, he's a gift educationally that just keeps on giving. He's an amazing man. We're going to be co-presenting. He's going to do the neural and the structural pieces and so forth. I'm going to get into two areas specifically. Obviously, we're going to talk about thermographic imaging, but I'm also going to talk about the emotional pieces and how they tie in. I'm going to show you what an emotional low back pain really looks like, but more importantly, I'm going to show you the triggers that cause it and how you can actually get rid of them and make a huge difference. So don't forget, if you would like to join us, and I encourage you, if you're in the Washington metropolitan area, please join us. It's at 6 p.m. at the Roselle Center in Fairfax. All you have to do is go online, go to rosellecare.com, or go into drtomroselle.com. That's just drtomroselle.com. That's our educational radio and live stream platform. And there'll be a area that you can just click and register, but please register. We'd love to give you the tools. We'd love to give you the things that you need to help yourself. That's why we do these programs, by the way, because you deserve it. And, we've been at this game, I have, for over 47 years, and I've seen virtually, anything that has been out there has shown up in my practice at one point or the other. So we want to share that data with you. But when we're talking about normal patterns and healthy back under the thermographic image, if you will, we must understand first, we have to understand what a healthy back is like. What does it look like on thermography? What's normal, what's not normal? And then we have to look by, what's the now situation that's showing up compared to what it was in the past. By the way, for me, I get a thermogram every year in full body. I check everything out because, this body has been abused and used and, kind of left in a heap periodically with a lot of things I've done over many, many years, from, playing sports that, some people wouldn't do, jumping out of perfectly good airplanes. There was lots that has taken place. And got back into, martial arts when I was in my 40s. And, it's a long, drawn-out story. But nevertheless, this imaging, thermographic imaging, begins to show you subclinical pathology, things that are underneath the surface, if you will. And it shows it up by differentiations in heat patterns. And that's the important piece. You have to understand that physiologically, that the body, when it's in pain, and if there's muscle contracture, tissue contracture, bones that are degenerating and so forth, will give off an abnormal signal called heat. If it's chronic over a long period of time before it flares up, it's going to look abnormally cold. So a chronic degenerative something that is not in an acute crisis situation is going to look cold. Now, pathology that is now is hot, it's hurting, it's bad, it's inflamed, is going to show up by warmer picture with slightly cooler areas around it or even significantly cooler areas around it. And that goes across the board for all kinds of things. So, for example, if you have an inguinal hernia, and what I mean by that is that if you go down to the top of your pubic bone, and you come up just a little bit on either side, that's the inguinal area. And when I come a little bit on either side, I'm talking about an inch, and you just go into that area. That's where you're going to get a lot of the hernias. And that's going to show up if it's there. Now, why am I talking about that? Because even a slight herniation in that area can cause a neurological reflex to the low back. Now, when that reflex occurs, now you're going to have muscle contraction at the site of the referral. And that's going to heat up some pathology. So I'm going to show you what that looks like. It's going to be fun, to kind of dig it up. There's also things that we call hypothermic trends in the body. What do I mean hypothermic? Hypothermic means that it's low temperature. And you have to make sure that you understand that there are certain things that initiate these low thermal responses. A compression of a nerve root, for example, can, in the later stages, not in the initial stages, but the later stages, can cause a low thermal response. So that by itself will tell you, oh, hey, this is old, this is chronic, it's been there for a long time. Now, so let's say that there's pathologies that fall within the classification and that range from radiation, radicular spinal pain from a fusion, including spinal cord injury, disc herniation, sciatic compressions, things like that, all right? And they will show up, many cases, as a hypothermal situation. It'll look blue, it'll look cold. And when we see that, we know that it's been there for quite some time. So you begin to put the pieces of the puzzle together, and you start saying, oh, wow, that's where it's coming from. And now we can not only be more specific relative to any additional diagnostics that we want to do, but more importantly, we can finger point exactly what the best treatment process will be to resolve this thing. In every situation, if you want something to totally turn around, to become much better, you got to have two people working at it. You have to have me and you. So I can't do it for you relative to things you have to do outside. I can set the stage and make sure that we begin to, decompress the nerves, balance the muscles, give you the nutrients that will help you heal. But there's other pieces that we have to do, and we cooperate with that with some hey, listen, you continue eating this stuff. I know you love it for right now, but, we have to get this thing healed. Again, we're not going to be the guy that's going to beat you, but we're going to be the person that's going to give you the understanding that if you really want to resolve something, this is the way that it has to be. So let's get back to this imaging while we still have a few minutes here. The basic premises of this imaging, of this thermographic analysis for low back pain, if you will, are variations in skin temperature. And these variations in skin temperature can direct, finger point, give you very specific evidence relative to underlying disease processes. So the newer technological advances in thermographic imaging has been amazing relative to helping us really understand more of what's going on. There's an article that was published in PubMed, NIH. It's called Thermography, in musculoskeletal diseases. It was published in 2023. It's called The Fundamentals of Infrared Thermal Imaging. I would look that up. It's really an interesting process. But, it's coming from all over the place. Same year, there was another one called Optimization of Image Capture Distance in Facial Thermograms. And that came out of, all places, Switzerland. And then Japanese journal in anesthesiology using thermography. There was an interesting journal. So if you look this stuff up, it's all over the place. It's not just, Dr. Tom telling you that, all these things exist. They're there, they're valid, and they've really helped us into really being much more accurate, if you will, in our diagnostic modes. So I would encourage you to, do your homework. Remember what I've said always, my obligation, my role in this whole process is to provoke you. And that means to get you to do your own homework, to get you all jacked up enough. I don't want you to believe anybody at face value. Yeah, maybe you can listen to me because I'm not always going to tell you the truth. But I want you to say, that doesn't sound right, and go do your homework. And then look at those things so you can really understand what the process. But this Wednesday evening, 6 p.m. at the Roselle Center for Healing in Fairfax, join us. You're going to have a ball. I'm going to show you all kinds of things. I'm going to show you that emotional piece. I'm going to show you how to fix it. And we're really going to have some fun doing that. You're going to say, wow, I didn't know that. But I'm going to show you how to turn it off, too. But Dr. Browning's going to get into and show you structural pieces and postural configurations and things that can be done. I promise you it's going to be a very, very interesting evening. So make sure you get online. Go to rosellecare.com or drtomroselle.com. Register for the class. Please be our guest. We'll have a great time. By the way, you know how much fun we have. We just had a women's weekend, a flower weekend with all kinds of things. We try to continue to do these things for you, so you have, a better understanding relative to what's possible, what's not possible. It's really important that you become the master of your own health. Remember my book, Ageless Health. Health is a do-it-yourself program. By the way, it's still available. You can get that if you'd like. But please understand that if you are vigilant, if you begin to give yourself the evidence, and don't listen to the talking heads out there, do your homework in multiple areas. Go into Frontier. Go into PubMed, all the journals that I look at. And, if you have a question, you send me a note. Go into drtomroselle.com, ask the question. I'll get back to you. I promise I will. As always, we're here to serve you, and that's why we're doing this. But this Wednesday evening, join us. It's going to be great. It's going to be fun. Now, as soon as I'm done here, don't leave me. Follow me onto Ageless Health live stream, and you can find it on all your social media sites. Tell your friends to follow me and to get the information that we're putting out there. And remember, this program's for you. I do this ongoingly for one reason only. Really simply. I love you all. Have a great Sunday. Bye.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder can be painful, and only a skilled neuromuscular dentist can diagnose and treat it. If you are in pain and suffering from TMD, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMD and how Dr. Michael Chung has successfully treated his patients. Call 703-319-6990 for a complimentary consultation or visit bestinsmile.com. That's 703-319-6990 or visit bestinsmile.com.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Low Back Pain on Wednesday, August 14th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellcare.com. That's rosellcare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellcare.com. That's rosellcare.com.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.